Hello students, my name is Rajgun Hendik, Assistant Professor, Assam Downtown University. Today I am here to discuss with you all about the concept of hospital and its classifications. So before starting, let's see what does a hospital mean. So as defined by the World Health Organization Expert Committee, a hospital is a residential establishment which provides short-term and long-term medical care consisting of observational, diagnostic, therapeutic, and rehabilitative services for persons suffering or suspected to be suffering from a disease or injury, and for pathorians. It may or may not also provide services for ambulance ambulatory patients on an outpatient basis. The World Health Organization Expert Committees also states that the hospital is an integral part of a social and medical organization, the function of which is to provide for the population complete health care, both curative and preventive, and whose outpatient services reaches out to the family in its home environment. The hospital is also a center for the training of health workers and for biosocial research. Now we come to the classification of hospitals. So the hospital are classified based on different criteria. Some of the criteria are: number one, based on objective. So based on objective, the hospitals are classified into general hospital, special hospitals, and teaching cum research hospitals. The next criteria is administration, ownership, control, or financial income. So based upon this criteria, the hospitals are classified into government or public hospitals, non-governmental or private hospitals, semi-government hospitals, and voluntary agency hospitals. The next criteria is the length of stay. So on this criteria, the hospitals are classified into two types. Number one is short-term or short-stay hospitals. So in this type of hospitals, patients stay less than 30 days. The other type of hospital is long-term or long-stay hospitals. So in these hospitals, the patients tends to stay for more than 30 days or 1 month. The next criteria is depending on type of medical staff. So based on this, the hospitals are classified into closed staff hospital, open staff hospitals. The next criteria we have is based on the bed capacity or the size of a hospital. So based on that, the hospitals are classified into three: small hospital, which consists of up to 100 beds, and next is medium hospitals, which consist more than 100 and less than 300 beds, and then comes the large hospitals, which consist of more than 300 beds. The next criteria is based on type of care. So based on the type of care provided by the hospitals are classified into three types: primary care, secondary care, and tertiary care. The next criteria is by teaching affiliation. So based on this criteria, the hospitals are categorized into two: teaching hospital and non-teaching hospitals. Based on system of medicine. So based on the type of medicine used in the hospitals are also classified into 5 categories: The hospitals are allopathic hospitals where allopathic medicine are used, then Ayurvedic hospitals, homeopathic hospitals, Unani hospitals, and hospitals of other system of medicine. Then next we have the criteria that is based on regionality. So based on this, the hospitals are classified into regional hospitals, district hospitals, Upazila Health Complex, Union Health and Family Welfare Centers, and community clinics. As per the WHO, the World Health Organization classification, the hospitals are classified into regional hospitals, intermediate or district hospitals, rural hospitals. So now we will discuss about what do you mean by general hospitals. So general hospitals are meant to provide wide range of various types of healthcare but with limited capacity. They care for patients with various disease conditions for both sexes to all ages, medical, surgical, pediatric, obstetrics, eye and ear, etc. Usually, general hospitals are devoid of super specialty medical care. The next we have is special hospitals. The special hospitals limit their service to a particular condition: orthopedics, maternity, pediatric, geriatric, oncology, etc. Then comes teaching cum research hospitals. In this type of hospitals, a college is attached for medical, nursing, dental, or pharmacy education. The main objective is to provide medical care. Teaching and research is secondary. So, government or public hospital, they are owned, administered, and controlled by the government. They provide free care for patients. The government hospitals are owned by the Ministry of Health, the university, and others. While a public hospital or government hospital is a hospital which is owned by the government and receives government funding, in some countries this type of hospitals provides free medical care free of charge, the cost of which is covered by the government reimbursement. In Australia, public hospitals are operated and funded by each individual state health department. The federal government also contributes to its funding. Next we have is private hospitals. So private hospitals are privately owned or controlled by an individual or group of physicians or citizens or by private organization. For example, Square Hospital, which purpose is to provide services for profit making. Then comes semi-government hospitals. These hospitals are run both by the government and private entity. The next we have is corporate hospitals. Hospitals which are public limited companies, which are run by the public limited companies formed under the Companies Act. They run on the commercial lines like Apollo hospitals. Then comes voluntary agency hospitals. These hospitals are not for profit hospitals which are run by the voluntary organization. The next we'll discuss about the short-term or short-stay hospitals. These hospitals where over 90% of all patients admitted stay less than 30 years. And in the long-term or long-stay hospital, in these hospitals, over 90% of all the patients admitted stay for more than 30 days. For example, mental hospitals. The next type of hospital is the closed staff hospital. The physicians are held responsible for all medical activities in the hospitals, including the diagnosis and treatment of patient fee payment, paying and emergency. The next type of hospital is the open staff hospital. This type of hospital permits other physicians in the community to admit and treat patients to the hospital and treat them. The open staff hospital. The open medical staff, which means any physician can request to practice at the facility regardless of their hospital affiliation. The closed staff hospital. A closed staff hospital system is one in which all the doctors are on staff, and also doctors that aren't on staff may not have access or privileges at the said hospital. According to the level of care. So as you know that based on the level of healthcare provided, the hospitalized are categorized into different groups. First of them are the primary care hospital. The primary care hospital is the day-to-day healthcare given by a healthcare provider. Typically, this provider acts as the first contact and the principal point of counting care for patients within a healthcare system, and coordinates the other specialist care that the patient may need. It provides mostly basic healthcare. It is generally regarded as the gateway to receiving more specialized care. The next type of hospital based on the level of care is the secondary care hospital. In Bangladesh, this level of services are provided in the district hospital. This is the first level of referral services, and more complicated services are dealt with, which is beyond the scope and capacity of the primary level. This level is assigned to provide some specialist the services, particularly in internal medicine, general surgery, obstetrics, gynecology, and pediatrics. They are usually 50 to 200 bedded hospitals. Then third is the tertiary level hospital. This level of hospital deals with the highly specialized services provided at regional or central level hospital, such as teaching hospitals, super specialized hospital like cancer hospital, chest hospital, infectious disease hospital, mental disease hospitals are also included in this level. This institution provide referral support to primary and secondary level healthcare. This also includes divisional and national level hospitals. So as per the World Health Classification, the hospitals are classified into regional, intermediate, and rural hospitals. So the regional hospital provides complex range of treatment and highly specialized services to a larger area than a local hospital. For example, Government Medical College Hospital. Then comes the intermediate or district hospital. A district hospital typically is the major healthcare facility in its locality. Specialty services in major disciplines, for example, medicine, surgery, gynecology, etc., are provided in this type of hospitals. Then comes the rural hospitals, the remote hospitals with a small number of beds and limited service capacity. It usually have around 20 to 100 beds. So I would like to end this presentation by saying that the hospital is a kind of institution which deals with the healthcare activities. It is an institution that provides treatment to the patients with specialized staff and equipments. It serves humanity as a whole and is an integral part of the social welfare of a society or a state. Thank you.